Hi, good afternoon. I'm Mary Beth Hepp-Elam, and I'm the School to Career Coordinator here at Churchill High School. This afternoon, we have careers in physical therapy, and we have two physical therapists to share their career pathway with us. So first is Rachel Burch, who is a pediatric physical therapist, and Ryan Burch, who's a physical therapist.
Ryan Embley.
Thank you so much. I'm sorry, not Ryan Burch.
Not related.
No, not related. Ryan Embley. I am sorry. So Rachel, if you'd like to start us off, that'd be great. Thank you.
Yeah, sure. So let me share my screen real quick. All right. So again, I'm Rachel Burch, physical therapist, working here at Oregon Medical Group, and I work with primarily pediatrics. And this is Ryan.
Hi, I'm the clinic manager here, and I've been working here for almost 5 years, just at the Westmoreland Clinic. And we're excited to be here with you today.
Yeah, so first we're just going to start by introducing ourselves and then just really talking about how we got into the career and kind of what brings us here and what we like about the career.
So this is me. I got my bachelor's degree at Brigham Young University and I majored in athletic training. It was a great opportunity. I had chosen the major of athletic training, always knowing that I wanted to be a physical therapist. I had known since the time I was a teenager that that's the field that I wanted to do, and thought that by doing athletic training, it would be, well, one, a great opportunity to just be a part of the sports teams there at Brigham Young University, which was awesome. But also just knowing that in athletic training, I was going to be able to apply the things that I was learning in the classroom, as opposed to a lot of my peers who more just had the schoolwork with it. So it was really great, a good opportunity for me. But then went off to physical therapy school at Emory University. For me, I got a bit of a later start with, I didn't actually get accepted the first year that I went to apply to PT school, but it was a good opportunity because I was able to stick around and work with the football team at BYU for a year. But then went off to Emory University, and it was great. I love that school, right in the middle of Atlanta. Lots of traffic, but it was a really good place. And so my program was 3 years in length and offered a variety of different specialties that you could do afterwards. But yeah, I stayed there. And then, as you can see, I got my specialty in orthopedics. So after I graduated from Emory University, really wanted to be able to get into a place where then I could get extra training to do a residency. So a residency is not necessarily required for physical therapy, but it's a way to get more hands-on training after graduating from graduate school. And so that's what brought me out here to Oregon. And I really liked what I saw in their residency program here. And so, yeah, just specialized in orthopedics from there.
Awesome. And I'm Rachel. So I, unlike Ryan, didn't go into my undergraduate career. So undergraduate being kind of right after high school. I wanted to work in museums was my game plan. I loved art. I loved history. And so I got my major in art history, and I got a couple minors along the way of just things that I was interested in. And you can see it wasn't in relation to anything science or healthcare or anything of that sort. So I took a little bit of a different path. My plan was never to work in healthcare originally. But after I graduated from undergraduate, I got I started working, and I took a job as a nanny working for a family with a child with special needs. And one of my main responsibilities was taking him to his therapies. So he had a lot of complex needs. And so he would go to physical therapy, occupational therapy, speech therapy, and doctor's appointments, and et cetera. And then I would go home with him. And when I was with him at home, kind of my responsibility was to help do his home exercise program, which is a part of doing physical therapy. And so I would help him with that. And it was his physical therapist that actually told me that I should go to PT school, which I had never really considered and thought that I couldn't do with kind of having an art history degree. So I had to go back after kind of getting my undergraduate degree and take the prerequisite courses, which we'll kind of talk about a little bit later in the presentation. But that kind of, once I took those classes, I was able to apply to school, and I started school at PT school at the University of Alabama at Birmingham. And so there is where you kind of really kind of get a lot of the knowledge, and they set you up to become more of a generalist at my school. But there were some opportunities such as our clinical rotations, which are a part of school where you're working in the clinics, where you can kind of pick what specialty you're kind of interested in and find clinicals in that area. And so I did a clinical knowing that I wanted to do pediatrics coming into it. I did a clinical working in early intervention, which is going into children the age of 0, kind of babies through the age of 3, working in their homes. And so that's what I did for my clinical. And then after that, as a new grad, I moved out here to Oregon and started a job. Now we're at an outpatient clinic where patients come to the clinic and we work with them there. And I work with all ages from the age of birth all the way to the age of 18.
So yeah, we kind of touched on it a little bit about what physical therapists do, but a lot. And it depends on what specialty or what area you want to go into. There are a whole host of different things. And so, but I'd say the majority is assessing where people's functional deficits are and seeing how to get them back to functioning the way that they would like to or need to. A lot of that is also then identifying sources behind pain and what those causes of the pain are. And so, like, for example, in my practice, I really enjoy watching the biomechanics, which just means how the body moves and how the shoulders intertwined with the spine and the neck, and just looking at that, where the deficits are in the movement and where we need to work on it. So yeah, as you can see here, lots of different things with the musculoskeletal system, neurological, just with the brain and nerves, integumentary systems. There's some wound care, physical therapy. We'll get into more of that later on, and cardiopulmonary systems, which oftentimes, like in orthopedics, we cover a lot of those 4 different areas that are listed there, in a variety of different ways. But physical therapists really do a whole host of things, and I've had the opportunity to even work with NFL athletes, NBA athletes, and just love helping them get back to doing their craft and what they want to do. So yeah.
So yeah, I think a lot of the things that go into PT is that there's a lot of different types of settings, which means kind of the place where you're actually treating the patient. But then there's a lot of specialties within those settings as well, meaning the different types of patients that you're working with based on what kind of conditions you're treating. So here's kind of just an overview of those settings and specialties. So you can work in a hospital, which is a lot of people are looking at, can you get out of bed? Can you go home, or do you need some other more intensive care following home, because you wouldn't do so well at home? You might fall, or you might have get injured or something like that. You're too weak to function by yourself at home. And so the patients that do have more difficulty functioning at home for whatever reason, typically go to an inpatient rehab, which is where you do a lot of therapies all at once and you stay at that facility. And then a nursing home, many of you are probably familiar with. PTs work in that setting. And then there's home health, which is the PT is coming into the home of the individual. And then that's also kind of, you get different kind of age populations with that. Outpatient is where Ryan and I work, which is kind of like a doctor's office essentially, or a clinic where you go there and you do kind of your therapy. And then primarily pediatric PTs are working in school-based and early intervention, like I mentioned before. So if you want to go over the kind of more of the specialty.
Yeah, so there are a number of different specialties of orthopedics, and in order to become a specialist, it requires extra time dedicated to that sort of field and an exam after that. So I took my test. It was an 8-hour test in orthopedics, and I did that a couple of years ago. So there's orthopedics, which is what you generally think of as your typical outpatient physical therapist. Then, like Rachel was saying, she does more pediatrics, working with that younger population. Cardiovascular and pulmonary would be helping people who maybe have suffered heart attacks or have a variety of different heart conditions. And a lot of that is building up endurance again. Geriatrics is more, excuse me, working with the elderly and in their specific needs. Sports, like I kind of alluded to, there are different physical therapists that work in a variety of different sports with high level to lower level. And then public health is more, I guess, related to maybe more pregnancy type issues, lymphedema, people who have excessive swelling. Oncology, more working with those who have cancer, and then wound care, like I talked about. So some of that involves helping people who have had severe burns or just wounds that maybe won't close. Yeah, so lots of different fields that you can choose.
Yeah, and all those specialties can kind of happen within these different settings as well. Mm-hmm. So for me, working as a pediatric physical therapist, it's more the type of patients that I'm working with, and that relates to their age in pediatrics. And then some of the diagnoses fall into more pediatric type categories. But pediatric therapists work in hospitals, they have inpatient rehabs, they work in the homes, and they also work in outpatient clinics. So, and that applies to pretty much all the other specialties as well. So becoming a physical therapist, so there's 2 different routes you can really take to work in the field of physical therapy. And one is being a PT. Ryan and I are both PTs. It's a doctorate level degree, and you're required to have a 4-year bachelor's degree, and you have to take specific prerequisite courses. And most of those are falling into the sciences, so chemistry, biology, statistics, those types of courses, anatomy and physiology, to kind of give you a foundation before going into the graduate program. And so typically the doctorate of physical therapy programs are 3 years. There are some different kind of programs that do different things. So some you can if you know you want to go into PT as an undergraduate, there are some programs that do 3 years of a bachelor's and 3 years of a doctorate program that you kind of pre-apply to. And then there's like pre-entry kind of programs. There's all kinds of stuff going on, and there are some accelerated programs where you finish in like 2.5 years. So there's a lot of variety between the programs, but the most standard is to do a 3-year PT program. And so you do have a doctorate when you graduate, and you can perform evaluations and do treatment as well. Now, a physical therapist assistant is a associate's degree, and they work underneath a physical therapist. And so they perform treatments, but they cannot perform evaluations. And there's lots of benefits to that. It's less time in school. So it's 2 years as opposed to about 7 years of school after high school. And then it's also less money that you're spending to go to school. PT school is very expensive. And so looking at kind of how much it costs and stuff is something that you should kind of look into, is really important. And then on top of that, kind of school is also very competitive. Getting into really any medical field and healthcare field with a higher kind of degree it's fairly competitive. So really building your resume is one thing that's really important as a student in high school and then going into your undergraduate career. So doing things like observation hours. So going into the clinics and seeing what these therapists are doing and how they work with their patients and those kind of things. And I think that's really important to decide, is this career really something that you want to do? And before you spend a lot of money on school, I think that's really important. And then also building your resume in other ways by getting good grades is really important, because that's one of the first measures. If you don't have good grades, you get kind of pushed to the back of the line. Doing volunteer work and taking on leadership roles in clubs and other things really look good on a resume and are what schools looking for. They want you to be involved and excited and be a leader, because that's what the profession kind of demands. So anything else you would add about school?
Yeah, and it seems like diversifying your resume is also a good thing too. Yeah, I don't know if I would add anything else though. Seems like you covered how to get into PT.
Yeah. So, and then that just leaves time for any questions and answers.
So I have one question to start out with. What would be, if you had any one or two things to tell a student to help them prepare to become a physical therapist, what would those one or two things be? And if I could get an answer from each of you, that'd be great.
Oh, there's so many things.
I know.
I think I kind of touched on it in the presentation, but I think that observation time is so important, because there's things that I love about being a PT, and it's a great profession and I'm really passionate about what I do. But there's a lot of things that aren't so lovely, like dealing with health insurance and, just kind of the workload and keeping up with those kind of things can be very demanding. So you really have to have the type of personality that's going to be able to manage kind of the insurance companies and the things that aren't so fun about PT. The documentation is another part that comes with the job. And so making sure that that is something you want to do, and different settings are different for everyone. So you may feel like, no, I would never want to work in a hospital. But maybe outpatient is a great place for you to work. So those observation hours are really kind of helpful in kind of, is this career really for me? And kind of what area do I kind of want to look at, and where do I want to work? And not all PT students necessarily have it figured out by the end of PT school either. And that's another thing that's really nice about the profession, is that you can kind of jump from setting to setting, specialty to specialty if you'd like, unlike kind of some of the other medical professions where you have to kind of specialize early and then it's very hard to change paths down the road.
Yeah, I mean, I would definitely reiterate that knowing what you're getting yourself into is very important. So definitely observation hours, but also I'd say it does take a lot of work, a lot of study. And so I'd definitely say getting some good grades, focusing on school, making sure doing what you can to just be a good student.
Okay, good information. So my other question is, what's your favorite, if each of you could answer, what's your favorite part of being a physical therapist?
Yeah. So me, it's because I work with pediatrics, I'm working with kids all day. And it's really fun. Some days I'm playing with a baby and I'm just like, and they're giggling and they're cute. And I'm like, man, I get to do this for work. And really just helping them achieve those goals, whatever that goal may be for whatever person. When parents come in and they're ecstatic because their baby rolled over for the first time and you've been working on it for 2 months. Stuff like that is really rewarding, and knowing that you have played a part in helping them, and just kind of that relationship that you build with your patients, and for me with the whole family, is they really place their trust in you. And we also get to spend so much time with our patients as compared to with other healthcare professions. Is we're generally spending 30 minutes to an hour with a patient at a time. And so we really get to know these patients and what their daily lives look like. And in some settings, they're in their daily lives, they're going into their homes. And so it's really exciting to be a part of that and to really build those connections. And so you really get to kind of feel the rewards of when they feel better and don't have pain, or when they can, jump up and down, just kind of depending on whatever the kid is happy about, and you get to play a part. And so that's my favorite part.
Yeah, so spending time with people is the reason that I went into physical therapy. That was the main thing that drove me to this profession. And so in doing that, though, you really get to become friends with the people that we work with. And so I'd say probably the best thing is to get to know somebody and get on a higher level, and just help them accomplish what it is that's important to them. It's the best thing in the world to hear them come back and say, yeah, I was able to do XYZ, whatever it was that was important to them. It really doesn't matter. Yeah, that's just my absolute favorite part.
All right, well, thank you so much. Can you stop the screen share right now?
Oh, yeah. I think so. How do I? Oh, stop share. There we are.
All right, great.
We don't have much Zoom practice because we've actually been in person.
Right. Well, thank you so much for doing this and allowing our students a snapshot into your day. And I appreciate your time and effort. It was a great presentation. I do have another question. Would it be valuable as to get some observation experience for a student to maybe observe those different clinical atmospheres, like going from a nursing home, or I call it, or a rehab clinic, to inpatient and outpatient? Do you think that would help build
For sure.
More complete idea of what a physical therapist can do?
Yeah, and most of the applications require at least a orthopedic seems to be the main one, but then they also require just, when I applied, it was like a certain amount of orthopedic and then just 2 other settings.
Like different.
It didn't really, it didn't really matter
so many
what it
hours.
was.
Yeah. They want you to have a certain amount of hours. And now I know with COVID, a lot of them have had to change that, just because it's been harder to get observation time because people are limiting how many people are coming. But I think, I want to say it was like 30 hours. It's a good chunk before applying to PT school. So if you start kind of early, as a student in high school, you can definitely use those hours as time for that.
Oh, wow.
Yeah, so I was an aide before I went to PT school, and so I had well over 1,000 hours, which helped my resume.
And then when I was working with the kid with special needs, when I would take him to his therapies, that counted. And the physical therapist was okay with signing off for those hours. So there's lots of different ways to get hours, is either working in the clinic, or for like me, like I was working with a kid that was going to PT, those kind of things. So there's ways to get still some of that time outside of specific like observation time. But yeah, I think having a better idea of what the scope of PT is, because it's huge. I think if people knew more about what the scope is, I think more people would be interested in the profession.
Great, great. Well, thank you for being here today. And we will look forward to seeing maybe you in person in one of our health services class in the future. But thanks again for being here.
Yeah, sure.
Yep.